It is estimated that there are over 2,000 patients suffering from nodding syndrome, which presents seizures and epileptic attacks. Since 2012, doctors have been searching for the possible causes of the syndrome and possible treatment for it. Today, the Makerere School of Health released a research that is a continuation of the wider scope aimed at containing the disease which affects the brain. The research has revealed that patients who were given doxycycline antibiotics suffered less effects of the disease.
The children on doxycycline died less compared to those that were not put on doxycycline, and it had an impact on the proteins that are generated by the microfilaria.
The high number of people with other forms of epilepsy outside nodding syndrome, many of them are actually also caused by this same black fly. It will appear from our findings that children who are infected by the black flies heavily and early in life may develop nodding syndrome, and those who are infected later in life appear to develop the other forms of epilepsy.
Many of the children who suffer from nodding syndrome are always prone to other accidents like fires and other burns that end up affecting them or crippling them. It has also been revealed by this same research that those with brain damage, it cannot be reversed, and there are about 200 of those.
That the group of children that had brain damage because of constant and persistent seizures have disabilities that cannot be reversed, but they need to be supported. And their support should come through rehabilitation centers that are managed by Ministry of Gender, because these children are no longer sick, so they don't really belong to the Ministry of Health. All they require is rehabilitation.
The findings further confirm that the disease is mainly transmitted by the black flies, which are common around River Aswa in northern Uganda. Dr. Aceng says government is concerned about the border of Uganda and South Sudan, which still has cases of black fly larva sites.
There may be cross-border infection. And so even as we carry out surveillance, we'll continue to harvest the flies and check them out for the microfilaria. It is not yet time to put our guards down or to dance and say the battle is over. No.
Health researchers say they have established some of the cases of the syndrome in Kasese and Kawalore.
From Kabarole going down up to Kasese, again, that area has had a very high prevalence of this worm, and the number of cases has really markedly gone.
The samples, which were collected and tested, the results have been sent back to the communities where they were picked. The RDCs and district health officers have been asked to inform the communities to collect their results. Sudil Yarhanga, NTV.